Hello and welcome to Principles of Persuasion. In this video lecture, we'll be discussing health communication campaigns in our final of our campaign series. So far, we've discussed social marketing campaigns and political campaigns, and today we conclude by discussing the interpersonal and mass-mediated action areas of health campaigns. To overview today's video lecture, we'll first talk about some of the barriers to improving health communication now. These might be areas in which we might see effective strategic messaging designed to create health campaigns to otherwise eliminate some of these barriers. Secondly, we'll talk about some of the interpersonal motives or forms of community dialogue we might think about health campaigns trying to appeal to or otherwise targeting as forms of strategic discourse. And third and finally, we'll talk about some examples of health communication campaigns, and I'll encourage you to think about some connections you might be able to make to the previous theories we've talked about, like narrative theory, cognitive dissonance theory, social judgment theory, or elaboration likelihood modeling, in addition to some of those others. Before we identify some of the reasons why we should improve health communication in the United States, it might be necessary to overview some of the reasons why health communication is challenged. I'll identify three barriers. The first barrier is patient interactions. It might surprise you to know that in the United States, studies have shown that the average patient only speaks for between 18 and 24 seconds before the physician or the doctor interrupts them to suggest that they might have understanding of their complications or cause. Research indicates that even if those patients were allowed to speak at the longest amount of time possible, they typically wouldn't speak for any longer than 2 minutes. And so, part of what we need to improve in our patient-doctor interactions is the ability for patients to most effectively express their conditions and symptoms, but also for doctors to be able to engage those conversations in ways that don't lead to interruptions. They have to remember, these are high-status conversations, and in those instances, individuals are reluctant to interrupt those who have higher status. And so when a doctor interrupts you, you tend to stop speaking and listen to what the doctor has to say, even if that doesn't align with those symptoms or conditions. In this sense, it could lead to misdiagnoses or otherwise have serious outcomes in terms of the diagnosis or the effectiveness of the treatment. Additionally, expanding on the amount of time provided beyond that 24 seconds, somewhere closer to that 2-minute range, might allow doctors to be able to identify some of the key cultural differences among various different demographic groups to allow them to make sure that they're effectively tailoring and targeting their treatments in ways that recognize the differences among many different Americans in the United States today. Another barrier to effective health communication is health literacy. When we talk about health literacy, we're talking about the way that patients understand the complex jargon and medical terms that are often used by doctors or those in the offices around them. And so in this sense, patient barriers might be reduced or otherwise improved communication if interactions were simplified or if patient and doctors were able to better speak the same language. And this is where communication scholars come in. And so a number of communication scholars have sought to focus on what they term health literacy. So an understanding of health literacy is important for both patient and provider, so that they know that the terms that they're using between one another are otherwise on the same level and ground. This way, if a doctor is asking a patient whether they've been performing the various physical exercises of their rehabilitation, and the patient is suggesting that they have, the doctor knows that that patient understands the various moves they're performing. The final barrier to effective health communication that we'll identify today is physician training. It might surprise you to know that pediatricians, those who specialize in dealing with adolescent children, see on average over 93 patients per week. That large patient load, coupled with the 18 to 24 seconds that they're provided, means that their communication is relatively limited and it has to be streamlined for efficiency. Our hope as health communication scholars isn't that they'll speak for longer, but that they'll speak with more efficiency and effectiveness so that they can better diagnose and treat individuals in those communication sessions. The reality is that only 30% of individuals working in the medical field feel as if they've received adequate training in counseling and various forms of behavior modification techniques. Now, you can imagine as we relate this back to pediatricians, this is particularly important as we're talking about ways that they might be able to communicate with young children. Additionally, most physicians report positive learning and better communication interactions actually follow communication strategies and trainings can lead to improved health communication outcomes. And so many in the pediatricians and physicians actually aspire to improve their communication interactions to empower patient advocacy and care, which leads to an opportunity for many young students studying communication who might seek to find ways that they can improve and benefit their communities. You might think about the roles that health communication has in your community and the way you might be able to find careers that help serving doctors and patients, providing that functional linkage and perhaps providing some of those key services like educating doctors about communication strategies and tactics in large workshops or services. Indeed, more and more doctors are signing up for various workshops and services related to how they might improve their health communication strategies and tactics. The field of health communication as a whole has seen an explosion, and it's one of the largest growing career fields for young communication students. Why might they be so focused on improving their health communication strategies? Well, there are a number of reasons why providers might seek to improve health communication strategies. The first is that providers care about the people that they're working with, and so they want to have the most effective health communication relationships that they can with those individuals. In addition, they aspire to help their patients, and research shows time after time that more effective communication leads to better patient outcomes. It truly saves lives. Third, many providers note that they receive little communication training, but that various different forms of communication barriers that they face in their career challenge them from establishing effective relationships with their parents. And so the hope is, with an increasing need to recognize diversity and inclusion within the practice of clinical care, doctors will be more likely to turn towards young communication scholars like ourselves to be able to learn some of the effective strategies for interacting with patients in ways that might improve their health outcomes.